welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 494 new cases of COVID-19 on Friday, inching closer to the 500 mark. Of the new cases, 471 were locally transmitted and 23 were from overseas. 7 additional deaths have been reported, with the death toll rising to 1,716. The numbers comes as the Prime Minister on Friday announced the government's decision to extend the current distancing measures. Now let's take a listen to the briefing.
코로나19 대응 방안 등을 설명하겠습니다.
네, 3월 26일 금요일.
Let us now begin our regular briefing for March 26th, Friday. As of today midnight, we have 471 new local infections and 23 new imported cases. And yesterday we had 7 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Yesterday, we have carried out some 30,000 vaccinations, and starting from February, we have an accumulated people of 770,000 people who have been administered with the COVID-19 vaccination. And here are the adjustment measures to the social distancing measures. And starting from the 20th and to 26th, we have had about 414 cases on a daily basis, and we are having a daily tally hovering around the 400 mark for the consecutive days, and we also have about 70% or about 300 cases being concentrated in the metropolitan area. And in the non-metropolitan areas as well, we are seeing sporadic cluster infections, and they also have the daily tally standing above 100. And these cluster infections stem from various meetings, gatherings, family gatherings, public use of facilities like public bathhouses and workplaces, preschools, and so forth, which are closely related to our daily lives. And we believe that the public is experiencing a high level of fatigue against the prolonged COVID-19 outbreak, as well as the intensified social distancing measures. And we also have seen the foot traffic increasing by every week, and we are seeing that this level is near the level of the one that we have seen in mid-November. And we also have about 607 hospital beds for the intensive care units, which are sufficient right now. And we also have about 10,000 hospital beds available for patients with mild or moderate symptoms. And against this backdrop, we have listened to the opinions of the local governments as well as many experts, and decided to extend the current social distancing level for another 3 weeks. And we believe that this will contribute to containing the possible 4th wave, and also facilitating a smooth vaccination as well. The current level of 2 in the capital area, and also the level 1.5 in the non-capital area, will be extended for another 2 weeks until April 11th, starting from next Monday. And we will also have the maintaining of the gathering ban on private gatherings of 5 or more people. And we have seen many infections stemming from the failure to comply with these quarantine measures, like include wearing of your face masks. And we believe that this shows that people are being complacent against such quarantine measures. And in order to intensify the basic quarantine measures, when we will be revamping the social distancing scheme, we will be having the guidelines and being so that they can be implemented in advance. And these basic guidelines will be implemented regardless of the social distancing levels that are put in place. And please note that these are basic rules that need to be abided by. And they will be divided into individual guidelines and also by facilities. And these facilities mean the guidelines that need to be abided by at workplaces and multi-use facilities. And we will be intensifying our rules for entry log. This means that all of the users to a public use facility need to write their information. And also, we will be having the mandatory electronic log for all of the high-risk facilities. And we believe that indoor sports facilities as well as public bathhouses need to notify their users of the restriction on the number of users in their front door. And we will also prohibit any activities that increase the respiratory droplet traveling. And this means that at cinemas, people will be refrained from eating or dining or drinking. And also at the sports stadium, they will also be prohibited to consume food or beverages and also sing and chant. And we will also mandate all of these facilities to have a quarantine manager who will be looking at the updated conditions by each facility. And also they will be also mandated to carry out disinfection and ventilation on a regular basis as well. They will be supervising these measures and including the gymnasiums and sports stadiums as well as exhibition halls and galleries. They will also be mandated to comply with these measures. And as for indoor sports facilities and private academy schools, we will be categorizing them by types, and they will be tailored to different guidelines by their types. And we will also have these guidelines to be revealed to the public through our respective ministries as well as government local authorities. And we will have a grace period about 1 week. And after that week, we'll be having stern measures for those who breach these basic guidelines. And please note that these basic guidelines are mandatory and are crucial to prevent further spread of the virus and also contain the spread of the virus here in the nation as a whole. And we need to intensify the basic guidelines, and we need to intensify our compliance in order to contain the virus going further. And these guidelines have been provided by the government, and it is very difficult for us to provide a uniform and also one solution that could also fit all of the facilities that exist here in the nation. And we believe that by having specific tailored guidelines, we could increase the efficiency. And so we ask for your continued participation and cooperation. Moreover, we need to also highlight the fact that anyone with suspected symptoms of COVID-19, we need to also let you to get tested as soon as possible. And we have analyzed the latest COVID-19 cases and infections, and we saw that about 23% of these infections were cases where people with symptoms went to the public use facilities and thus spread the virus to other users. This means that we could have prevented these many cases in advance if this one person did not visit the multi-use facilities. So if you have any coughing or fever or other respiratory symptoms, we need to also ask you to get tested as soon as possible. We will be cooperating closely with the medical circles and at doctors, clinics, and hospitals and at pharmacies. If you see patients with suspected clinical symptoms of COVID-19, we will ask these medical professionals to direct their patients to the screening center for rapid testing. Once again, we would like to highlight, if you have any clinical symptoms, please get tested as soon as possible, and also please refrain from going to multi-use facilities that are crowded and frequented by people, and please take good rest at home. And we believe that there are many people moving and going to the parks as well as other outside places to enjoy the beautiful blossoming of the spring flowers. And we will be also intensifying our quarantine measures for all of these spring festivals as well as any places of biggest spring outings. And we would like to also advise you to restrict the number of people who are traveling together and restrict these members only to your immediate family members, and also only have one-day trip. And we also ask you to refrain from going to crowded places and also avoid traveling to far distances. And also, as for group tours that are provided by tourism companies, we ask you to have a designated official who can supervise the quarantine conditions. Please note that these large-scale spring festivals could be prone to virus infections, because many people from diverse provinces and districts could come to these places. And also, when you are enjoying your outing, if you take off your mask to enjoy food or beverages, please also note that this could raise the risks of infection. And also, we would like to note that at tourist destinations, we will be intensifying our monitoring of these quarantine measures going forward. And we will also exert our full efforts to continue to implement these measures as a whole. And we will also like to intensify our quarantine measures for public transportation. And as for large limousine buses for tourists, we will also like to identify that we will be increasing the monitoring of the quarantine conditions. And you need to also have a designated official who can look at the overall quarantine conditions. And please, we ask all of the others to abide by these measures. And if you visit high expressway rest areas, please abide by the mandatory quarantine measures there as well. And after returning home from your travel or outings, please monitor your condition so that you do not have any symptoms. And if you do develop clinical symptoms, please do not go to school or work or visit multi-use facilities that are crowded. We need to also highlight that during the past week, the members of the public have complied effectively in the quarantine measures, thus helping us to contain the virus to a large extent. And we believe that in order to stabilize the current large outbreak, we need to also highlight the importance of complying with these quarantine measures that are very basic and fundamental. So if you have any clinical symptoms, please get tested and also wear your face mask and wash your hands and keep social distancing as well. The government will also exert our full efforts so that our members of the public can return to a state of normalcy. Thank you very much.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 494 new COVID-19 cases on Friday, and this brings the accumulated number of COVID cases to 100,770. There have been 7 more deaths, raising the death toll to 1,716. We'll wrap up the coverage here, but we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.